Now, when we talk about this neuroimaging in patients with headache, sometimes we get very confused. Who needs CT scan? Who needs MRI scan? Who needs CT with contrast? Who needs MRI with contrast? So I have just tried to find out what would be the ideal. Say if you suspect a meningitis, then CT or MRI of the head without contrast is good, but you have to get an LP also after that. So whenever now this rule is that whenever you are putting the patient for a lumbar puncture, it's important that you get a CT scan done before. So if you suspect meningitis, yes, you got a CT, but lumbar puncture will give you the final diagnosis. Sudden onset severe headache, worst headache of patient's life, where we talk about thunderclap headache, CT head without contrast, CT angio with contrast, magnetic resonance angiography with or without contrast, or MRI without contrast. So when I are doing say CT or MRI, you are doing it without contrast. When you are doing the angiography needs contrast, so you have to do some with contrast, but MRI also can be done without contrast. Headache in patients older than 60 years with suspected temporal arteritis, you know that we need an ESR, but along with it, it is important to get an MRI also. Severe headache in pregnancy, CT or MRI without contrast media, you have to go for an immunocompromised patients, MRI with or without contrast. Now, severe unilateral headache caused by possible dissection of carotid or intracerebral arteries. Here, there is no point waiting for the CT. Either MRI or MRA or CTA you have to do in these cases.